Everything is so fresh and new when spring arrives. So what if you want to look younger this springtime without looking like you had something done? GMT's Paige McCoy Smith talks with plastic surgeon Dr. George Toledo.
Skin grafts are typically used to treat burns and serious wounds, but did you know that they're becoming very popular with people who want to look younger without looking like they've had something done? Plastic surgeon Dr. George Toledo of Highland Park Plastic Surgery Center is here to show us how. Good morning to you.
Good morning, Paige.
All right, let's talk about this. It's called dermal skin grafts. They become increasingly more popular when it comes to facial rejuvenation. Tell me why they've become more popular and kind of how they work.
Plastic surgeons have figured out over the last 5 or 10 years that the face needs volume, not just pulling and stretching. That makes it look unnatural. And so we've been doing too many facelifts and not enough facial augmentation. There's temporary ways of doing the augmentation with fillers and fat injections, but this is a dermal skin. It's your own skin. We take it from your belly, from a little tummy tuck type of incision or a C-section incision, and we transplant it to the face.
Wow.
And it's permanent.
And so it's permanent, and it doesn't give you that taunt look.
No, you still need a little bit of a lift, but it's really more filling than lifting.
All right, and you've got an image of a woman that has had some challenges. So show us what her problem areas were.
This is kind of a typical 60-year-old that you know, you could see that right in here, this area needs to be filled. The temples are kind of sunken, as you can see, where we fill in the temples and we fill in the orbital rim areas, as well as the lips. And in this needs to be lifted with a neck facelift. But if you keep pulling this up and stretching it, it looks unnatural. Okay. So it's better just to fill it. To fill the upper third of the face and lift the lower third of the face. So you can see how the cheeks are fuller, the orbital rims, the temples are fuller.
That is a dramatic difference. And as you're saying, it's filling the face instead of pulling the face back altogether, and it really does show a dramatic difference.
I mean, she still had eyelid surgery, and she still had her neck lifted and a forehead lift. But it's more natural when you can fill this area up with her own tissue.
Wow.
And the lips were also enlarged.
That's a dramatic difference. Okay, tell me about this woman and what did you do?
Well, we did a little sculpting to her neck. This is a young girl, but we can use that same dermal graft to augment the chin. And you can see the difference in the chin on this person. It's, you know, it's 5 millimeters, but it makes a big difference.
It makes a huge difference in her profile. That's pretty dramatic as well.
Of course, this is tricky to do, but you know, it works.
Wow.
And the lips, we use this all the time on the lips. There's artificial lip implants. There's fillers for the lips. People are putting strings of Gore-Tex, but if you take your own tissue and put it inside your lips, it stays soft. It's not rejected. And it lives like a skin graft does on a burn patient. It stays in there and lives.
So it has more permanence. It certainly looks a lot more natural. It's a great alternative.
Well, the key is the fillers hurt, and you've got to do it every 6 months. An artificial implant is stiff, so you can't pucker, you can't smile right. I mean, it feels like a piece of silicone in there. Wow. Whereas this is soft.
No, it's so great to know
that
we have these alternatives. Thank you so much for giving us some insights into this. And you can find out more by calling Highland Park Plastic Surgery Center. That is 363-4444. You can also check out Dr. Toledo's website at ToledoPlasticSurgery.com.